Hi everyone, it's Dr. Prabakar from the Fibroid Doc, and I am continuing my series on the HPV virus and cervical cancer this week. And so if you haven't listened to my previous episode on, how do I get rid of HPV, make sure you take a quick listen there. Today I'm going to talk about this question, what is a colposcopy? So if you're somebody who has an abnormal pap or you've had HPV, your gynecologist may say, I want you to come in for a colposcopy. So what exactly is that? Sounds a little scary. So the good news is a colposcopy is a fairly quick procedure that is done in the office. The beginning of the procedure is very much like a pap smear, where we use a speculum to take a look at the cervix, and then we use a special vinegar to kind of paint the cervix, and then use a colposcope, which is a special microscope, to take a look at the cervix and kind of search for any abnormal looking areas. And then we use a forceps to take a couple biopsies. This is overall a pretty quick procedure. It's about 2 to 3 minutes long. And once the biopsy is done, if there's any bleeding, we stop that, and then you're done. It's done under just some, anesthetic spray. You don't need any general anesthesia, or you don't need any shots or anything like that. And it's done in the office. It's, as a routine appointment. If you tend to be nervous, I always recommend that patients just bring in some earpods and, listen to some music, meditate, whatever it takes, deep breathing to distract yourself for those few minutes. And then you're pretty much done. You get up and go home. You may have a little spotting, sometimes a little bit of cramping that, you can take a Motrin or Advil for. And I would definitely refrain from intercourse for about a week, just so you don't blow off any clots that are formed there after your biopsy. So it sounds a little scary, but overall it really isn't. It's a pretty quick procedure, and the whole point of it is to take a detailed look at your cervix and look at the tissue through these biopsies and see if this HPV virus has really done any damage to your cervix, and hopefully not. And sometimes if it has, just to make sure that the level of damage is consistent with your pap smear. And so that's the whole point of the colposcopy, is just take a deeper dive and take a look at your cervix, okay? So hopefully this information has been helpful. If you are gearing up for a colposcopy, hopefully this information has helped you prepare a little bit, and good luck with that. And I'll see you in my next video. Bye everyone.